I'm Dr. Anthony Maloof from Cornea and Oculoplastic Surgery and Eyes and Faces in Sydney, and welcome to this video edition on Does Makeup Damage My Eyes? Patients love to ask me this question. I hear it all the time and women are worried about it. Well, the good news is that most makeup in countries that have regulations, has been tested endlessly. I'm not going to get into the ethics of do they test it on animals, but it's been tested and there is very little toxic effect. In fact, in more than 30 years, I've never seen a toxic effect from makeup. And that's good news, but it's not all good. There are problems. And let's put these problems into three groups. The first problem is application, the second problem is removal, and the third problem is particulate. Let's go to the first, application. The most common problem we see with application is injury to the eye, inadvertent injury. You put an eyeliner on or something like that, you brush the eye and you cause injury to the surface of the eye. The skin is removed, that's an ulcer, and the problem with that is you can get infections and it is very painful. But there's another problem. Those ulcers can actually come back to bite you. They're recurring ulcers. We call them recurrent erosion. So what's the answer to that? Just be careful with your application. The second thing is removal. Removal can cause problems. When women remove makeup, they usually do it by wiping, and in doing so, they undo every preventative measure they have in trying to avoid wrinkles. Wiping the eye is very problematic, and most people do it aggressively. By doing that, they stretch their skin, give themselves wrinkles, droopy eyelids, watery eye, and can even lose vision. What's the answer? Be very gentle with your eyelid wiping when removing makeup. The final problem is particulate matter. Women use foundation and particulate matter in their eyeliner, and that gets into your eye. The problem with that is, it's like little particles that pass along the tears into the tear drain and block the tear drain, just like grease in your drain and your kitchen sink will block it. Over time, those little particles can form stones, which can give you infections, and tear drain obstruction, giving you watery eye, which is really annoying. What's the answer there? Be very conservative around the eyes. Take it easy, don't overdo it. It's tempting to do it, but when we look at you under a microscope, your tears are flooding with these particulate matters. So in the end, it's very safe, but take the precautions of don't injure yourself with the brushes, be very gentle when you remove it, and don't apply too much. Thanks for watching. I'm Dr. Anthony Maloof from Cornea and Oculoplastic Surgery and Eyes and Faces in Sydney.